Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Monday, March 16th. It is 5 p.m. I had nothing really specific I wanted to talk about today. I was going to continue the vitamins and minerals talk, which I will continue pretty soon. But I shared some stuff yesterday in my Young Living Oil group about the COVID-19, and I wanted to share a little bit with you guys, and it may not be able to be done in one session. So depending on how you guys comment and feel, I may extend a day or so more. I have not followed the news today, so I don't know the updates. But I want you to understand, hello Cecilia, I want people to understand why the healthcare system, the government has isolated everybody. Hi, Rhonda. If you look at the curves they're talking about, where they talk about this big spike of infection and then it dropping off rapidly, where then you get the massive recovery versus flattening out the curve. In terms of immunity, okay, strictly based on immunity, it is far better to allow that massive peak for it to be a shorter period of time where everybody gets sick, that's going to get sick, and then everybody gets better. Okay? That said, because this is so far spread and so many people are going to be affected, not in a serious way, but a lot of people are going to get this COVID-19. But because of that, we would massively overwhelm our healthcare system. And currently, the fatality rate related to this virus is about 3%, maybe a little higher, 3.4%, depending on which source you find. That number would be much higher if we allow it to just run its natural course, okay? Simply because we would overwhelm the healthcare system, and people who were sick that should recover would not, simply because the healthcare system would just not be able to handle the massive load of incomers, people that are sick, right? Hi, Kim. So because of that, they want to isolate us, because if you think about, they think about a box, and they show this, the Washington Post had a really good article yesterday where maybe I can share it below, where they do this kind of like a ping pong thing where one person is infected, and then as they contact other people, and sorry, my hands are moving around, it bounces off other people and those get it, and then they change color as they get it, and then they change color again as they recover. By isolating and putting like a wall and only allowing some people to get through to contact other people, you see how it takes longer for people to get to that point where they've created that immunity, and longer for us to recover. But by doing that, here, if this is the healthcare system's capacity to take care of people, flattening out the curve keeps us below that, so that the people who need health care will receive health care, and the majority of people that do will recover. Okay, there still will be deaths. There still has a 3.4% mortality rate, regardless of how you look at it. But by flattening out the curve, we're basically extending the duration, slowing down the natural immunity process that happens, and making it better overall for our society to cope with the numbers. That is simply the only reason why they're doing this. Okay, if it was any other reason, if you want herd immunity, throw everybody into a room, let everybody get sick and get over it. Okay, I remember as a kid when my sister had chickenpox, my mother put my brother and me in the room with her so we'd get it too. Okay, because that way it would be over. We'd all have it, it would be over with, and she wouldn't, done. Again, that's chickenpox. That's not COVID-19. I'm just saying, in general, everybody. Woo! Hang on a sec. My TV just turned on. Sorry about that. So that is how herd immunity develops. As you get minor exposures to things, your body develops immunity to things that you're exposed to every single day. And you develop antibodies because you got a small dose, but your body could fight it. It went away. Maybe you had some minor symptoms. Maybe you had a very low-grade fever, or you had a mild cough or sneezing, and you didn't even think you had COVID-19. Maybe you thought you just had a cold or allergies, or maybe you get it bad and you think you just have influenza. Okay? So there's the thing that I want to make sure that you understand is that is the only reason for the isolation. Okay, it's not because we're trying to prevent people from getting it. We are going to see a rise. People are going to get COVID-19. There is no stopping it regardless of, the only way they could have stopped it is when the first case came out in China, we shut the doors. That's just not going to happen. Okay, so that said, one other point that needs to be addressed. Today, 1.9 million tests were released to the general laboratory population here in the United States. That's a good thing. But that means we're going to see a spike in positive cases, not because suddenly it's spreading faster, but simply because we are now testing people we were not testing before. Okay, the same thing happened in South Korea. The same thing happened in China. We will see a spike. Do not panic. Okay, because those numbers are not, I don't want to say it's a false positive. They are positive, but they were positive before, we just never tested them. Hopefully those people are self-quarantined, or they're the presumptive positives that we are waiting for tests for to make sure that they do or they don't have. Lastly, for today, I just want to talk about differentiating your symptoms from other respiratory type illnesses that are out there all the time, and when to go to seek medical attention. So the biggest differentiating factor between COVID-19 and influenza, rhinovirus, allergies, etc., is the dry hacking cough. Okay, most of the time you do not have a dry hacking cough when you have those other types of conditions. Okay, fever is another one, but fever comes on with influenza. But with influenza, you usually get a big spike in your fever and then it comes down. You usually have fatigue and chills as well. With COVID-19, they're saying that's not typical. It's usually a gradual, slow building fever that doesn't necessarily, only 45% started with fever, and then during the illness, about 85% will develop fever. Okay, so fever in and of itself isn't differentiating, it's the pattern of the fever. And shortness of breath is really only in about 20 to 30% of people, and usually in the severest cases. Now, everybody is at risk, okay? Yes, it's less dangerous, they believe at this point, in children. They're also saying that in women who are pregnant, for some reason, they're actually not having as bad a time. Although if I was pregnant or I knew somebody that was, I'd say be careful and watch who you're exposed to. The highest risk groups are people over the age of 80 with coexisting medical conditions. They're saying people over the age of 65 as well, because there is an increase in that age group, and over 70. But over 80 is where there's the highest mortality. Okay, but in and of your age by itself is not the only factor that plays a role. If you have diabetes, emphysema, asthma, cardiovascular disease, or cancer, and you fall in those age groups, you are at higher risk. Now, all of those conditions, well controlled, still puts you in a higher risk, but makes it less risky, if that makes sense. Okay, you're not, I mean, if you have very bad asthma and you are constantly short of breath, and this is a time of year that you're really bad, then you're at risk. Okay, but if your asthma's under control and you haven't used an inhaler in a year, you're just like everybody else. You have a medical condition that's under control or in remission or whatever it may be. So just because you have a labeled diagnosis, don't panic. Okay? So tomorrow I want to talk about that. I want to talk about stress and how stress is going to negatively affect you when it comes to any health condition, including infections, including COVID-19. So please tune in tomorrow because I want to talk about that. It's really important that you have a plan, execute your plan, be smart, only go out to do things that you need to do, but stay calm. Okay? So on that note, I hope you guys are staying calm, having a great day, regardless if you're indoors or outdoors. And I will see you again tomorrow for another Live in 5.